Welcome everybody to Discovery Health. I'm Dr. Kelly Filmer. And first thing that I want to say is Happy Thanksgiving. It is Wednesday night, November 22nd, 2017, and it's the evening before Thanksgiving. So I hope you're all having a wonderful day and have some great plans to spend time with family and friends. I'll tell you that I made 2 pumpkin pies today and I've made a cherry cheesecake, all with great ingredients, organic, and really did a great job. Everything's turning out great, and I'm going to have a good day with my family tomorrow. And in fact, we were just playing a family game tonight, and we had to stop. We love playing this game called Bang, and it's a cops and robbers kind of a card game. But we took a break so that I could come and talk with you. Hello, Nicole. Hi, Tim. Hey, Nancy. Good to see you here. Hi, Raquel, Andrea, Karina, Cassandra, and Annie, thanks so much for coming. And again, happy Thanksgiving and thanks for joining me. I wasn't sure how many of you would actually come tonight. Make sure, as I always request, and I appreciate so much you doing, share the videos, okay? You asked me to do this video. Iodine was a hot topic for Monday, and I got tons of questions, and they were great questions. Most of the questions that people were having, though, was around Hashimoto's and thyroid disease and the iodine. And when I talked on Monday, I wasn't ready to dive all in to just thyroid. So that's what we're going to do tonight. Hello, everybody who just joined. Thanks so much for being here. You can click on a button right away, right now, and share this video on your Facebook page. I really would appreciate it if you do that. So I am going to share my screen with you again tonight. And the reason that I'm doing that is so that you can actually learn a little bit from me tonight. Okay. When I talk about Hashimoto's and iodine, it's confusing. I know it is super confusing for not only you, but for your doctors as well. So I've done a lot of talks about thyroid disease, about iodine. I have listened to the experts and I have learned more in depth how exactly the thyroid works to make me comfortable and excited and confident to know that when you have autoimmune thyroid disease, I know you still need iodine, but I know that many of you have read that you should stay away from it. So this video is for you to clear up the mud and to help you be just as comfortable as I am about knowing that you need iodine. So I'm going to go through a few other things. First, we're going to lead up to, and then I'm going to demonstrate for you the why you need iodine even when you have Hashimoto's and Graves' disease. So if anybody is on who has Graves' disease, you need iodine too, even though you're hyperthyroid. And often Graves' disease, you go up and down and up and down. You still need iodine. I'm going to show you how a lack of iodine started the problem in the first place. Okay? So let's see if I can get my screen to change here. And the purpose of a thyroid, few quick slides here in the beginning just to remind you all why the thyroid is so important. 27 million Americans have thyroid disease, and that number is underestimated. It's the metabolic governor of the body. I describe it to patients when I'm talking with them that it's the orchestrator. It's telling your adrenal glands, kick it up, we need more. It's telling your temperature, go up, go down. It's telling your body, store fat, get rid of fat. It's telling many other organs in your body to do more or do less, pick up the pace, slow it down. 80% of people with thyroid problems are women, and it's the most common endocrine disorder. So it far exceeds diabetes. It's a problem in the United States, okay? Now, this page, you can always go back and look at these slides. That's why I'm doing them. It'll be on my YouTube page. It'll also be on my website, drkellyfilmer.com. Remember as well that I'm starting to get more regular with sending out emails. If you want to be on the email list, go to my website, drkellyfilmer.com. You're going to see some videos out there. I'm also getting some blogs out there. You'll get the written version of what we're talking about tonight. in your email if you sign up for that. So I welcome you to come there. But this, I'm not going to go through this. It's all the different rules of your thyroid gland. So go ahead and glance at that. This is where your thyroid gland is. Pretty little picture here. You can see my cursor. You know, some other doctors out there, or like Isabella Wentz, the pharmacist, she has a butterfly for her symbol because the thyroid gland kind of looks like a butterfly. And it's right here on your throat. That's literally where it sits. Now, how many of you know actually how many hormones your thyroid gland makes? And let's get this out of the way right away, that TSH, if you have had your TSH tested in the past, it is not a thyroid hormone. It's a brain hormone that tells your thyroid what to do, okay? It senses how much hormone is there on a feedback loop, and then it says make more or make less, but it is not a thyroid hormone. I'm a strong believer in testing your thyroid hormones directly because they give me much better information, because that feedback loop can be delayed. It can be altered by other things. So the TSH doesn't always give you the picture that you're looking for. And testing your hormones directly is much more important and much more valuable in my practice. Why am I telling you this? There are 6 different hormones that the thyroid gland makes. This is your first connection with iodine and thyroid hormones. So T4 is thyroxine. You've all heard of that before, right? If you've learned a little bit more about your thyroid, you've asked your doctor, I don't want just a TSH. Please check my T4 and check my T3. Wonderful. T3, triiodothyronine, reverse T3, T2, and T1. And then there's also calcitonin. Those are the 6 hormones from the thyroid gland. Although technically calcitonin, which regulates calcium in your body, is made by your parathyroid gland, which is right on top of, actually within your thyroid gland. So what do each of these hormones have in common though? That's what I want you to think about. T4, T3, reverse T3, T2, and T1. Well, the T stands for something. The number stands for something else. So the T is tyrosine, and the number stands for iodine molecules. So thyroxine, T4, has 1 tyrosine and 4 iodine molecules. Okay? T3 has a tyrosine and 3, I have a hard time making a 3 iodine. Reverse T3 moves the positions of iodine. Okay? Is this making sense? You have to understand, you cannot make T4, which is the most abundant thyroid hormone, without iodine. If you don't have enough iodine, you can't accumulate 4 on that tyrosine. I'm going to show you that in some picture format too. Right here we go. The hormones are made of the tyrosine, which is right here in the middle. This HO and this gray block, this is tyrosine molecules, okay? I just explained to you that the T4 is 4 iodine molecules. The body actually makes T1 and T2, and then it combines them. So technically, it would be combining 2 T2s to make a T4, or it'd be combining a T2 and a T1 to make a T3. Okay, I hope that's making sense. Bottom line is 2 ingredients make up your thyroid hormones, tyrosine and iodine. If you are iodine deficient, you will develop a thyroid problem. If you are iodine deficient, it's the #1 reason for developing an autoimmune thyroid problem. Okay, I need you to understand that. Okay, autoimmune thyroid. Let's talk a little bit more specifically about that. What causes it? I just told you, #1 reason, not enough iodine. Remember what I told you about iodine on Monday? I talked about the thyroid, I talked about the breasts, I talked about ovaries, even the prostate, even the testicles. Iodine has a responsibility to create normal tissue in those endocrine glands, okay? So we talked about fibrocystic breasts or lumpy breasts. A lack of iodine makes the tissues in the breast not smooth like they're supposed to be. So now, knowing that, what do you think happens in the thyroid gland when you don't have enough iodine? The tissues in the iodine, or the tissues in the thyroid, are not working appropriately. They're not being made appropriately, or they're changing, or they're getting a little sclerotic, or they're getting a little lumpy. Do you think the body senses that, or notices that, or says, hey, Joe, what's going on with thyroid over there? Because, his tissues aren't looking as good as they used to. Something's happening. Something's wrong in there. The body knows what's happening in every single cell all the time, and it always wants balance. So when it sees something not right, it's going to try to fix it. If it doesn't have the right ingredients, it won't be able to fix it. But again, another reason why iodine deficiency changes are happening in the thyroid, and then a cyst develops, and then it can be a hard nodule, and then it can develop into thyroid cancer, all starting because the thyroid gland didn't have enough iodine and the tissues started to change. Okay. Other common reasons or possible triggers to develop autoimmune thyroid, because we're talking about iodine and autoimmune specifically, being mercury. Where do we get the most mercury? In your dental fillings. If you have those gray fillings in there, get them out. Cadmium, a chemical called perchlorate, fluoride, bromine, low vitamin D. I just spoke with a woman. Her vitamin D level was 32, and she was pretty darn happy with that. Now, granted, she should have been happy because her values used to be about 13, so she definitely had gotten them up. But I said, oh no, you have autoimmune disease. Her antibodies were in the thousands. Actually, the first one was about 1,500. She has full-blown autoimmune disease going on. She wasn't just starting down that road. Her vitamin D levels, I told her I want to see them about 80. There's great research out there around vitamin D. The lower those values go, the more at risk you are for different diseases. And actually, with levels less than 60, heart disease starts, diabetes starts, cancer starts, depression starts, all when your vitamin D is less than 60. So that's not okay. That's not okay in autoimmune disease. We need to get it up. Now, another super common thing that triggers autoimmune disease, and I'll tell you, for my autoimmune disease, stress was a huge factor, iodine deficiency, I had a mouthful of mercury, and I had some viruses. I had at least 4 things going on that triggered my autoimmune disease. These next ones, EBV, or the mono virus, you do not have to get mono as a teenager to get this virus. 95% of all Americans have this virus in their body, and it likes to hide in your thyroid. So does parvovirus B19. Hides in your thyroid. Do you think your immune system can see it? Remember, your immune system is responsible for fighting the bacteria and the viruses and the fungus and the things that make you sick. And cancer, it's responsible for seeing a cancer cell and saying, hey, pal, no, you don't belong here, get out. Your immune system takes care of all those things for us so that that virus or bacteria doesn't kill us. But now we have EBV and parvo, as well as other herpes viruses that actually like to get in our bloodstream. It gets into our thyroid gland, and the immune system says, gosh, where did he go? I'm going to find him. And it starts to attack those viruses in the thyroid tissue, causing destruction. Another trigger from your immune system. Autoimmune thyroid disease is an immune system problem. Sometimes we can just have the immune system problem side and not have a thyroid problem yet. Again, I had a woman just last week who was in that exact scenario. She was not hypothyroid, but she absolutely has autoimmune disease. And if we can reverse her autoimmune disease, we'll stop her from ever having hypothyroidism. So all of these are causes of autoimmune thyroid disease, and you, if you have autoimmune thyroid, probably have a couple of them too. So let's take a look at what iodine deficiency does inside your body, right? Iodine deficiency equals a swollen thyroid. This is an old picture of me. Yeah, looks nice, right? One day when I was thinking about thyroid, talking about thyroid more, and looked through some pictures or found some pictures, I guess. Well, guess what I found? This picture. This was a passport picture. And when I picked this picture up, because I had an extra one, it was just sitting in a drawer, and I had used it for my passport. Fine, okay, that looks decent. And I looked at it and went, oh my God, look at my thyroid. And I've outlined it here for you. Actually, I used to have an animation on this slide, and I'm sorry I lost it, but so that you could just see me without the line. And then I outlined the swollenness of my thyroid gland. It was really the first time where I saw a picture of myself and went, wow, look at my thyroid. That's horrible. So I really needed to start working on that and working on my iodine. Here's another picture showing you the exact same thing, but in a drawing. This normal thyroid here on the left-hand side as we're looking at it looks perfect. And then we come over to the right side. A goiter or swelling of the thyroid gland just means it gets bigger. Why does a thyroid swell? We have known this for 100 years. Or back in, the 1920s, I believe, is when they started to put iodine in salt to help with the goiter problem that had started. So iodine levels, as I told you on Monday, have gone down by 50%, and autoimmune disease has dramatically increased at the same time. So they're opposite. Your thyroid gland swells because it's trying to get more blood flow to pick out more iodine. It's trying to balance itself. It's trying to get what it's missing and what it needs. This, just to contrast what you saw in that last slide, again, this is showing you a goiter or just swelling. I also showed you that on myself, how my thyroid has swollen. I do not have a nodule, but my thyroid gland was bigger, and I've worked very hard to get that down. So that looks kind of like this over here. But this picture is a little bit different. This is showing you exactly what a nodule looks like. What I'd like to point out again is that 95% of the time, a nodule is benign. It means it's not causing you any harm. Your body did that to protect you. That's a different way of thinking about it, I know, but think about what I've already said to you. Iodine deficiency, the tissues start to change. The body wants to create balance. Think about those viruses. Think about anything else that I'm going to explain that causes damage in your thyroid gland. And if your body can't heal it, or I like to think of those viruses, they're the best example. If the virus is in that thyroid gland and your body can't take care of it, imagine that it's making a calcium cage or a jail. It's creating a jail within that nodule to lock up that virus so that it doesn't cause more damage in the thyroid gland. If it can't get it out, if it can't destroy it, it's going to lock it away to try to minimize the amount of damage that it's going to have. So often when the iodine deficiency or the mercury is playing a role in getting iodine and selenium into your thyroid gland, so the tissues are changing, your body will make a cyst there first because of that damaged area. If the reason for those cysts aren't taken care of, that's going to develop into a hyperplastic nodule, which just means it gets hard. It's bigger, hyper, and it's plastic, hard. So it's a hard plastic nodule. Still, that's not causing you damage or any harm. It's not cancer. But if that continues to progress, so you went from a cyst and now it's this hard nodule, it goes on a continuum and it will have the potential to develop into a cancer. Again, iodine deficiency is the easiest way to reverse that. And I have seen many nodules shrink or stop growing, which is still a great win when somebody gets started on iodine. So I apologize that I can see my picture is right up in the corner of these slides, and I have to actually change the screen if I'm going to move where that is. So sorry about that, but hopefully, oh, it didn't move. Okay, well, that didn't help us at all. All right, autoimmune thyroiditis. Inflammation of the thyroid gland. I just showed you that in a picture of myself. I showed you a goiter. Triggering the immune system results in an attack, iodine deficiency, viruses, mercury. How do we diagnose autoimmune thyroiditis? I've listed for you the 3 most common antibodies. With Hashimoto's disease, the thyroglobulin antibody and the TPO antibody are the most common. And then if you have Graves' disease, it's usually a thyroid stimulating immunoglobulin that gets tested. Antibodies are created from your immune system as a way to go attack the thing that's causing the destruction inside your thyroid gland. Does that make sense? Let me repeat that one. Autoimmune disease is an immune system problem, right? Immune system, if you read it on WebMD, says the immune system has gotten crazy. It doesn't know what it's doing. It's attacking self. Actually, it's attacking something that triggered something to go wrong in the thyroid for damage to start to happen. And the way the body deals with that is that the immune system creates antibodies, and those cells travel to the thyroid to say, who's causing the problem here? Where's the troublemakers? We're ready to lock them up in jail. We're ready to destroy them. We're going to, tag them and deflate them and get them out of here. The problem is, those antibodies actually are destroying some key components in the thyroid gland, and I'm going to show you that in a minute. Thyroid nodules and iodine. This is what you really came for. This is what you wanted to hear about. This is super interesting, and I've written the research down at the bottom. Where did this come from? I'm not making this stuff up. It comes from the literature. It comes from research. So from 1995, there was an article written in the Analyst that shows both benign and malignant thyroid nodules, so cancerous and non-cancerous nodules, have a lot less iodine than normal tissue. Actually, those benign or non-cancerous nodules only have about 56% of what's normal. And if it's a cancerous lesion, it only has 3%. 3% of normal. So that tissue is not functioning normally at all. It's no longer using iodine. It can't get iodine in there. It's so iodine deficient. That's why it's abnormal. Think about that. Now, quick little slide there, because there's always somebody who says, I can't take iodine. I'm allergic to iodine. That's not true. You might be allergic to something in a product, in a food that also has iodine. You cannot physically be allergic to iodine. These pictures are examples of what an anaphylactic reaction looks like. My throat's closing, I've got hives all over, severe stomach pain, your lips are swelling, your tongue is tingling. But you can't be allergic to iodine because it's in your body. So it's in your body 100% of the time because your body is using it. Every single cell in your body needs iodine in it. So you're not allergic to the iodine atom. You cannot physically be, or you would be dead from the moment that you were born because it's already in you. You can, however, this is some literature for you, so if you have a hard time believing that, I've got several different websites that later you can go back and highlight and put in your browser to take you to this information. But the Journal of Emergency Medicine has shown that allergies are not linked to iodine allergy. Has shown that shellfish allergies are not linked to iodine. That's what everybody thinks. I'm allergic to shellfish. I must be allergic to iodine. That is not true. Shellfish allergy does not increase the likelihood that you'll have a reaction to iodine. It's actually the protein in those certain fish that you're allergic to. All right. So just read through that when you have time. Sometimes people can put iodine soaps on or povidone, and it's still, they have proven it's not the iodine atom. It's something else in those products that you might be allergic to. So we just need to clear that up. If you take pure iodine, you cannot be allergic to it. So don't let that be a fear that stops you. Let's recap for a moment. Iodine. If you are deficient, you cannot make thyroid hormone. If you are deficient in iodine, Your thyroid will swell because it wants more iodine. Seafood is naturally rich in iodine, like cod and shrimp and scallops, sea bass, haddock, perch. Of course, sea salt, and we've talked a lot about salt. If you're gonna take iodine, you need to take salt. Sea salt, unrefined sea salt. Somebody asked me about kelp. Absolutely, it's the most common sea vegetable. It's great for giving you some iodine. Also cranberries and strawberries and eggs and turkey. Who's gonna eat turkey? We're not eating turkey at my house. Well, because it'll just go to waste because only a few of us will eat it and the rest of my family won't eat it. So we have a ham for tomorrow, just so you know, and prunes. Okay, this is the bulk. And I know this looks confusing. Follow my cursor. This is inside your thyroid. Okay, so the thyroid gland, and then this box up here in the left-hand corner is one tiny little follicle. Okay, this follicle, this kind of blobby circle in the middle, you have a whole bunch of them in your thyroid gland. Okay, hundreds of thousands in there make up your thyroid. So this little thing in the corner, this picture in the corner, is blown up right here. What I want to point out on this picture, you don't have to know everything here. There's not going to be a test. I'm not going to have you look at it for 30 seconds and memorize it and then write down what you've seen, like my son just had me do for his psychology test and I flunked. But anyway, what I'm showing you is iodine in the bloodstream. So this pink over here on the right-hand side is the bloodstream. And this is one thyroid follicle, iodide, and sodium. The sodium iodine symporter, NIS, okay? It takes in iodide and it takes in sodium. If you don't have sodium, you can't get in iodine, okay? Super important. If you can't get iodine into the cell. So we had that conversation too. Somebody said that their mom ate all kinds of fish and seafood and she still got a goiter. Well, that means she wasn't getting the iodine in. You have to have iodine, you have to have salt, both of them to get in. Okay, so that's right here. We take in iodine and sodium from the bloodstream. Now I'm going to fast forward way over here. See this word? Oxidation. This is really key. We're going to go through another slide that shows you it in bigger detail. But oxidation is this process. This iodide with a negative sign here went to iodine with this 0 sign here. So it's a chemical process of oxidation where that iodine changed. That's important. This is called organification or iodination. Oh, that's hard to say. But it's the form of adding iodine to something and the oxidation of iodine. All right, so another way to look at it right here, and why this is important is, I'm sorry that you can see my cursor here, right on this first red blob, this is thyroglobulin, okay? Thyroglobulin, why does that sound familiar? Hashimoto's has 2 antibodies, thyroglobulin antibody and thyroid peroxidase antibody. Both of those things are key to make thyroid hormone. So bear with me for a moment. This is where the attack is happening. So this red structure here, I have 3 of them on this page. That's thyroglobulin. Okay, come back to the first one. This molecule that I showed you in the beginning is tyrosine. What are the 2 ingredients to make thyroid hormone? Tyrosine and iodine. So thyroglobulin is this red backbone structure. Then we see the thyroid peroxidase. It plays a role with getting the iodine to attach to the tyrosine. Okay, you see that? Now we have a diodotyrosine, a tyrosine with 2 iodine. Di just means 2, okay? And then here at the end, we have thyroxine, where 2 diodotyrosines joined, and now we have 4 iodines. Are you seeing that? We need thyroid peroxidase to do that. We need thyroglobulin to do that. But I prematurely clicked and we brought up these cancel signs because when you have autoimmune disease, the body, those antibodies are destroying thyroglobulin and they're destroying thyroid peroxidase. If there is no thyroid peroxidase, you cannot attach the iodine to the tyrosine to make this diodotyrosine. If you do not have thyroid peroxidase, you cannot make thyroid hormone, T4. Right here is a T4, but I took out an important step here with the thyroid antibodies. This is a TPO antibody and just said, nope, that production line is going down. You're not making it. So same thing, the thyroglobulin antibody, well, if it's destroying the thyroglobulin, it takes out the tyrosine molecule. So I hope you're following me on that. This is where destruction happens when those antibodies are coming in. So what do we want to do? We want to stop the destruction. And if you do not have autoimmune thyroid disease, pay attention. If you do have autoimmune thyroid disease, pay attention because this is the part where I explain how iodine plays a role. So I've been leading you up to this. I know some of it was a little bit complicated, and if you didn't get it all, that's okay. That's why I'm the doctor, and I get it, and I can figure out what somebody needs, and we'll step them through the process to get their thyroid gland to heal. All right, follow my cursor on this as well. This slide I have taken from Dr. David Brownstein and from a presentation that he has done that I was listening to. So I absolutely give all the credit to him. He is a brilliant man. And as I've referred to him before, he understands iodine like no other. This is key, and this is what a lot of doctors do not understand. So I hope I can walk you through it to make a little bit of sense of why you have to have iodine for autoimmune disease. Okay, so those pictures that we were just looking at, this is the same thing, just it's laid out a little bit differently. So here's our friend TSH. TSH is a brain hormone. Thyroid stimulating hormone comes from the brain and tells your thyroid gland to make more hormone or make less hormone. But did you know it also plays a role, look at this little arrow right here, in this yellow box, NIS. The sodium iodide symporter. So Na is sodium, right? That's the chemical name for sodium or abbreviation Na. That's why it's NIS. So remember I showed you that the sodium goes in and the iodine can go in. They have to go in together. That's what this yellow box is representing. Your TSH stimulates your body to make more of those. So when you start taking iodine, your TSH is going to go up. Everybody's going to go, if you start taking iodine and your medical doctor tests your TSH and it went up, he's going to say, you need more thyroid hormone. No, you don't. Don't just go on TSH. The TSH is doing a different job at that point. It's not just telling you about thyroid hormone. It's saying, oh my gosh, guys, iodine is going past us. It's going past the bloodstream. We need more taxicabs. We need more symporters getting the iodine in. So TSH stimulates your body to make more of those. I really need you to understand that, because if you just go out on your own and start iodine and then you get tested and you see your TSH way high, you're going to freak out. Your doctor's going to freak out. But if you know it's because you took iodine and your body's trying to use it, no big deal. You need to ask the question, but where's my T4 and T3? That's going to answer the question that you need, okay? So there is no freaking out allowed about that. You know why it's going to happen. Okay, so here is iodine. Remember I talked about this oxidation process right here. Iodide to iodine, just represented a little bit different. And look at this, H2O2. Who knows what that is? It's hydrogen peroxide. I'll just answer the question because I can't see you. Remember, when I do these slides, I can't see you coming on or giving comments. But please write your comments, write your questions. I always go back, okay? So not only is TPO involved in this oxidation process, so is hydrogen peroxide. Who remembers hydrogen peroxide in the big brown bottles? You put that on a cut, what does it do? Bubble, 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 and it's killing all the bad germs, right? So I want you to think about that and actually visualize that. The hydrogen peroxide here is needed, okay? It is a key component to make this big long arrow work. But if it's left to get out of control, if there's too much, it causes damage. It causes damage in the thyroid gland. Now finish walking through this with me, because we've got our iodine now. Remember I mentioned organification. So that's the process of, here's your thyroglobulin. We're adding iodine to the thyroglobulin so it can get on the tyrosine. And the MIT is T1, the DIT is T2. Here we have T3 and T4. So iodine, the thyroglobulin, makes these hormones. It's a process called organification. Perfect! That's exactly what we needed. We got iodine in, it made our hormones. But there's more. This big thick arrow here, there's another organification going on. Actually, iodine gets added to lipids. And lipids are fats, and we need those to get iodine as well. Now, you don't have to remember what this oxidase system is, but I want you to take a look at the plus side and the minus side. This oxidase system makes the hydrogen peroxide. So there's a gas pedal and there's a brake. Okay, so the calcium makes more and more and more hydrogen peroxide. The lipids that have iodine tell it to make, oh no, we need to cut back on that. We don't need so much. No, not so much. So it keeps it balanced. Okay, I hope you're following me because that's really, really important. The calcium is the accelerator. The iodinated lipids is the brake. Okay, so again, calcium here, accelerator, iodinated lipids, means it can't do this without the iodine, is the brake to make just the right amount of hydrogen peroxide so no damage happens. You have enough iodine, you make enough hormones, the accelerator and the brake are balanced, no damage is caused. Okay? This next slide says that same exact thing. I wanted to put it in writing there for you so you can go back and look at that. Remember, when you take iodine, your TSH will go up until your body says we don't need to stimulate any more symporters. We don't need any more NIS, so it can calm back down. So the TSH is going to stay elevated until that problem is solved. That could be 3 months. It could be 6 months. If you have had autoimmune thyroid disease for a long time already and it was just never taken care of, expect that that TSH will be high for a long time. Look at your hormones. Stop worrying about the TSH in that case, okay? All right. Now, this is the same picture, but with low iodine. You don't have enough iodine at this point. How does it change? Here we have low iodine. It goes through the symporter. We have low iodine. We've got to make that into iodide. There's not too much conversion happening here, okay, because there's not too much iodine. But now this organification process is low. Look what happens. So we only have a little bit of iodine to go with that thyroglobulin. T1 goes up, T2 goes down, T3 goes up, and T4 goes down. What? That's all screwy. Your thyroid hormones go screwy. If you have ever seen high T3, low T4, you need iodine, okay? So it's an imbalance. There's not enough iodine to go around, and why it has a preference for that, I can only imagine, but T3 is the active form, so your body's having a preference for it. It's saying, well, we got to keep a little bit of energy going. I'm going to skip a step. I'm just going to go make a little bit more T3, and we're going to say, you know, too bad T4, you got the short stick, pal. Okay, so your thyroid hormones are all goofed up now. But what else happens? Look at this big red X. We're not iodinating our lipids anymore. Those were responsible for being the brake. So we have tons and tons of calcium in this oxidase system, and it's making high levels of hydrogen peroxide. What happens? Destruction. Too much hydrogen peroxide, it started a destructive process in your thyroid. And now your immune said, oh my God, what's happening inside there? A fire. A fire has started inside the thyroid gland. That hydrogen peroxide guy, he got way out of control and he started a fire. I'm going to make some antibodies. And here come in anti-TPO antibody, anti-thyroglobulin antibody. And it attacks TPO and it attacks thyroglobulin. Does that make the situation better or worse? A lot worse. It just makes it worse. It doesn't help it. It doesn't make it better. And now more destruction is happening because not only are your thyroid hormones all screwed up, now, two key ingredients to keep making what you were making is all kaput as well. What a mess. What do we need to do? We need to stop the destruction from happening. You need to be taking iodine. It's easy to test your iodine. If you're uncomfortable still with iodine, get tested. Have a urine test. Find out how deficient you are. Okay? It's easy to do. It's not that expensive. Get it tested. But if you've got autoimmune disease, if you're hypothyroid, I pretty much already know you need need iodine, because 97% of people tested out of a study of 6,000 people needed iodine. So I'm pretty confident that most people need it. But by all means, we can test and find out how deficient you are. What else do we need to do? Antioxidants start to clean up some of that destruction. So the hydrogen peroxide started the fire. Antioxidants are going to help put out the fire. Selenium does a wonderful job. It's a key ingredient for a lot of different processes in the thyroid gland. You need more of that, especially if you're deficient. Glutathione helps tremendously. B vitamins, B2 and B3, are great antioxidants to clean up your thyroid. We have to stop this oxidative damage. Vitamin C, perfect example. I always get people on these antioxidants. And magnesium. Remember, we've talked about Natural Calm as a great magnesium, but you need to bombard your body with magnesium because it slows down that calcium accelerator. Remember, the calcium side of that accelerator and brake, calcium keeps making hydrogen peroxide, makes more. Magnesium will slow that down. You need magnesium in your thyroid and for your brain and for your muscles and for your bowels. Take more magnesium. Sometimes I give glandular support. We target the inflammation, but you also need to target the other causes of autoimmune disease. Get rid of the mercury out of your mouth. Trust me, I know it's not fun. I've had a mouthful of mercury and I hate going to the dentist because I've had to have fillings put in and I've had to have fillings put out. It's horrible. I know. I feel your pain, but you need to do it when you have thyroid disease. Make a plan. You don't have to do it all at once. The bromine we talked about, the fluoride, the sea salt and selenium is going to help kick out some of that stuff. So you need to start taking those things too. All right, guys, that is the end of the show. And so I need to get out of that screen and find where I am here. Here I am. There I am. Okay. Awesome. Oh my gosh, guys. So that was a ton of information. I know it may have been overwhelming for you and I'm sorry, but I had to get into some of that nitty gritty detail or you wouldn't believe me. I needed to show you where iodine is used, how it's used, so that you can see what happens when it's not there. It created the fire in the first place. There are many other reasons why we have autoimmune disease, but iodine is a key one. It doesn't matter if you're hypo or if you're hyper or if you're euthyroid and have autoimmune disease, you probably need iodine. So I hope that helped. a ton. I hope it helped you a ton. I hope you all have a great Thanksgiving tomorrow. Please enjoy your family and your friends and take time to spend with them, okay? Because that's why you're here. I'm going to scroll back and look for a couple of questions, but it's already 9:15 and I still have a game to go play. So I'm going to wrap it up, but I'm going to look for any, oh my gosh, guys. Okay, so I'm going to go play a game, and then later I'm going to come back and I'm going to look at some of these comments and I'm going to address them. Good. Thanks, Carrie. I'm glad you joined. Yeah, it's super interesting. Kendra, glad that you're here. Thanks so much. Shelly, sorry to hear you have Graves, but you know, there's things that we got to do for you, right? All right, guys. I'm going to cut it off because there's way too many comments for me to get through. It's already been 45 minutes and I want you to get back to whatever you were doing. Please share my video. Please give me lots of feedback. Give me lots of likes. If there's something else you want me to talk about or something more, please go ahead and ask. Don't forget to go to my website. I'm working on getting that to be better, to get more stuff there. Remember, there's an email list there and there'll be some literature and stuff like that out there too. So, all right, guys, have a great night. I hope that you sleep well and have a great day tomorrow and a great weekend. I'll see you again soon.